3 in every 10 new HIV infections in Asia and the Pacific region are from young people between 10 and 24. And every hour, 13 more are infected. Many young people are unable to access HIV information and services because of issues that they face. For starters, many HIV programs do not even include sexual and reproductive health services. In the Asia Pacific, sexual and reproductive health and rights, or SRHR issues of young key populations, or YKPs, are overlooked in current HIV programs. Access to contraception and SRHR-related needs for young female and transgender women sex workers and young women who use drugs are often left out. Emerging SRHR issues such as hormones for trans women and menstruation management for trans men are also excluded. The links between SRHR and HIV are not yet completely established. Many countries in the region have restrictive SRHR laws affecting YKPs, like requiring parental consent for those under 18, restriction to spouses among married people, limitation of consensual sex only to those who are aged 18 and over, and the criminalization of sex work, same-sex behavior, and drug use. Lack of sexuality education limit young people's access and knowledge of SRHR. There's also no available information specific to SRHR issues of YKP. Despite this, YKP themselves continue to become the vanguard of change in communities. A number of youth-led organizations in the region have been documented to have reached the YKP and addressed their needs through education, advocacy, capacity building, and outreach. By extending SRHR information, services, and commodities to YKP, these organizations have changed the way current SRHR programming reaches out to young people in general. Investing in YKP programs that cater to their needs must be prioritized. This includes governments, UN agencies, NGOs, and other national and regional bodies to provide safe spaces for YKPs to discuss their SRHR and involve them in all levels of development. Policy guidelines on ensuring SRHR services for YKP that are youth-friendly and accessible must be supported and adopted. Allocation of budget and monitoring mechanism which will yield results including the reduction of HIV transmission and unintended pregnancies, and greater overall health and education of YKPs. Adoption of comprehensive sexuality education curricula with an emphasis on the specific SRHR needs of YKPs and special efforts to ensure that out-of-school YKPs have access to SRHR information. Sexual and reproductive health and rights of young key populations matter. To find out more, you can read the newest publication of Youth Lead entitled Our Rights Matter Too: Sexual and Reproductive Health and Rights of Young Key Populations in Asia and the Pacific.